Standard Operating Procedures Approach IS2. In this video, we will discuss participant recruitment in Approach IS2. First, participant must meet study selection criteria. For part 1 of the study, in which patient-reported outcomes are administered through self-report questionnaires, we handle the following inclusion criteria. A patient should be diagnosed with congenital heart disease, defined as gross structural abnormality of the heart and/or intrathoracic grade vessels that is actually or potentially of functional significance, including mild, moderate, and severe defects. The patient should be aged 18 years or older at the moment of study inclusion and should be diagnosed with congenital heart disease before the age of 10. He should be under follow-up at an adult congenital heart disease center or included in a national or regional registry. The patient should have enough physical, cognitive, and language abilities to complete self-report questionnaires and tests. And of course, the patient should sign the informed consent form. Patients who've had a heart transplantation cannot be included in the study. For part 2 of the study, in which assessments on frailty are performed, we handle the same inclusion criteria as we had for part 1. However, this is a selected group of patients, and we have 2 other inclusion criteria here. The patient should have a moderate or great disease complexity, as defined by the 2018 ACHD guideline. The link to this document can be found in the paper SOP. The patient should be aged 40 years or older at the moment of study inclusion. Secondly, documentation of participation and retention rates. Each participating center should complete the study progress checklist, which is an Excel file that documents the progress of data collection and data entry. In the file, the following things should be indicated: the number of patients who were eligible for study participation, the number of patients who consented to participate, the number of patients who completed surveys or assessments. As you can see, updates on data collection and data entry are asked. The study progress checklist can be found on the Open Science Framework folder, General Information and Documents, 1. General Information. The name of the file is File 1.9 Study Progress Checklist. The investigator should send a completed study progress checklist to the coordinating center on a monthly basis until data collection is finished. Thirdly, assigning study ID numbers. Each patient who consents to participate in the study is assigned a unique study ID number. Subsequently, this unique number has to be written down on each data entry file. The unique number includes the participating center's 3-digit center identification code, plus the 3-digit local patient identification number. For example, because the identification code of the University Hospital in Leuven in Belgium is 302, the study ID number for the first patient participating in Leuven will be 302001. Another example is the inclusion of the 23rd participant in Chicago, which has center identification number 408, who will be assigned unique study ID number 408023. Check the list of participating ID centers codes to verify the code applicable to your center. This list can be found on the Open Science Framework folder, General Information and Documents, 1 General Information, with file name File 111 List for Coding Patients. A list matching the unique study ID numbers with participant names and other personal health information will be retained by the participating center. At no time should this information or any personal health information be shared with the coordinating center of Approach IS2. Thank you for listening. If you have questions about the participant recruitment or other things, please contact me. My name is Liesbeth van Bulk and my email address is liesbeth.vanbulk@kuleuven.be.